show the range of the data that we used. So we utilized the Facebook World Symptom Survey. So for everyone's benefit, this is actually a weekly data snapshot that comes from the University of Maryland. It's a regular survey being conducted by Facebook. It's self-disclosed. So they ask people, have you gotten vaccinated? And do you want to get vaccinated? And what are the reasons? The total sample size for the globe is around, by this time, about 250,000. And for the Philippines, it's several 100,000. And I'm happy to say that it correlates quite well with the survey findings from DOH, Pulse Asia, and Minda. Another thing you'll notice here is that on the fifth column, you can see that the hesitancy rates across all these data sets vary quite widely. And this is something that is a reality in social science, that you'll never have a full view of the situation. And the important thing is, how do you make sense of all these potentially varied and conflicting pieces of data in order to craft a concrete intervention? So what we have done in our study is we have taken pieces of information from all these surveys and put them all together. We will use mostly the Facebook survey to get a sense of trend because it's updated more often. But in diving onto the reasons for these trends, we will utilize some of the national surveys being conducted. Let's start with the good news. The good news is vaccinations are up. So everywhere you go in the Philippines, more and more people are getting vaccinated. And this is in line with the prioritization groups by the DOH. What we want to highlight here is, although the trend generally is up, there are some lagging areas. No? So these are not all of the areas surveyed, but you'll notice, obviously, NCR is ahead of everyone else. But there are some areas, for example, Western and Eastern Visayas, that are falling back. And I think that's something worth diving into when we try to understand the factors for this. More good news is, in terms of hesitancy, generally the trend is down, and that's also good. This is also evident in other fields. The more people patronize a particular product, the more other people will be more disposed to patronize it. And if you can consider vaccination as a product that we'd like to market, generally people are following the same trend. Now, this is where what I was saying about nuance comes in, because if we combine the two data sets, this is what it looks like. Although generally the relationship is negative, so the more people who get vaccinated, the less people are hesitant. We're not saying what causes what. I think it's really the sectors or the clusters and the nuances that matter. For example, on the lower left are people who, despite exhibiting lower levels of hesitancy, are not quite up there in terms of vaccinations. And then on the other hand, the upper right quadrant, you have areas where, despite a higher level of hesitancy compared to the norm, they're also getting vaccinated. So it's not necessarily a one-size-fits-all compared to like upper left and lower right. And this is where the study that UNDP Pintig Lab chose to focus on. What accounts for all these differences? And maybe these differences are a venue for us to craft interventions. So we looked to the Minda, DOH, and Pulse Asia survey for this. In these surveys, they ask people if they had vaccines available, would they be willing to get vaccinated? And if so, or if not, what are the reasons? And this is a summary. I'll just highlight a few areas for ease of interpretation. So here in the upper left box, these are the top reasons people have stated the reason why they want to get vaccinated. And then here on the lower right are the top reasons for people who said they were either not sure or not likely to get vaccinated. What are those reasons? And I think this is very important for us to zoom in on, because if we look at everyone in the Philippines, it would be easy, it would have been easy if everyone thought the same way. But what we're finding from the DOH data is that there are actually very distinct segments, and not all of these reasons are present in each segment. So in our study, we found there's at least 7 segments in the population. I won't get into too much of the detail here. I encourage everyone to have a look at our report. But simply speaking, the first 4 segments in blue, these are the easy segments. They're the ones who already believe in the vaccines. They're the ones who are just waiting for availability or supply to come into their area, and they will be the first to line up. So the easy cells are the most convinced. They only have 1% hesitancy, all the way down to what we're calling the pragmatic segment. So they are willing to get vaccinated, but they're also concerned about lack of supply and the perhaps a tedious vaccination process. And this speaks to, vaccination is not easy to roll out nationwide, and there will be areas where vaccination is harder than most. But it's good to see that even on a survey, we're able to pick this up. On the latter three are segments that are less willing to get vaccinated. So you have the complacent and the obligated segments. Generally, they will get vaccinated, but they will not be the first to line up. Particularly the obligated segment, these are people who said, okay, if my work demands it or if my travel demands it, I will get vaccinated. But it's also interesting to see the reasons they are probably not willing to get vaccinated, which aren't present in the first four. Some segments, such as the complacent segment, don't even believe COVID is a risk. This is interesting from a literacy standpoint. Despite all of the overwhelming evidence of how dangerous COVID is, there are people who still don't believe that literature. There's also people who do not trust experts. And this talks to Dr. Vergere's statement earlier that despite our best efforts, there's still an undercurrent of anti-science and anti-expert sentiment. And we need to think about how to reach them. And lastly, you obviously have the skeptical ones who have no reason to get vaccinated and they believe all of the negatives, and they're probably the last, if ever, to line up. The last thing I want to highlight here is as far as in terms of media use, not everyone is on social media. And that's, I think, something to think about. Since the pandemic started, everyone has gotten used to working from home and having these video conferences and using social media as our main source of news. But what we're seeing from the survey results is there are segments of the population, especially the more hesitant ones, who are not reading social media. They're more driven by the traditional media like TV. And that means that a multi-platform strategy still needs to be in place. We cannot be doing everything on Facebook, Twitter, and TikTok. So how do we try to convert this insight into some form of intervention? And this is where we look towards communication science and technology adoption. So this is known as the diffusion of innovation curve. It's actually a well-established behavioral pattern. Anytime you have something new to adopt, for example, cellular phones, the internet, anything new that you want to introduce to a population, there will always be these 5 segments. The innovators and the early adopters are usually the ones who already believe the technology from the beginning. But to get to early majority, you need to cross what is known as the chasm. And that's where this webinar gets its name. And the reason for this is you won't get mass acceptance of an idea or a product until you hit early majority. And once you hit early majority, then you have this herd mentality. Maybe everyone will start jumping on that bandwagon. So what is the chasm? The chasm states that early adopters and innovators will be easier to capture because they already believe in your product. Some of them may have actually invented or driven that product, so you have no questions asked from them. But the moment you start crossing into early majority, you now have to start to address a growing reasons or concerns related to hesitancy. And I think this is where we need to focus on. Incidentally, the literature also shows that the chasm normally occurs around 13.5% to 15%. And I think based on the latest statistics, we're just about at that level already in terms of vaccination. We have about 12 million fully vaccinated. So we're about to cross that chasm, if not there already. If we overlay the 7 segments, it aligns quite nicely. So even though you have the first 4 segments who are generally willing, early majority states that we need to now address those subtle issues that the supporters and the pragmatists are looking at. And a lot of that can be operational, a lot of that is communication driven before we even get to the latter 3. We also attempted to look at the regional distribution. It also lines up quite nicely. But again, I don't want to oversimplify the issue. There's the presence of all these other segments within these regions. And I think that I want to underscore that even though we're looking at regional behavior, we need to dive deeper into each region and see how the distribution of these segments are in order to be more effective with communication. So that brings us to, I guess, the main crux of this presentation. COVID-19 is a health crisis, but it is also a social science problem because we're not just dealing with the progression of a virus, we're dealing with the progression of behavior.